Hi everyone, welcome back to our channel. I'm Kim McFarland, a licensed professional counselor and a national certified counselor from Michigan. Today we're discussing an important topic. How do I know if I need dialectical behavioral therapy and what can I expect if I start the program? Well, if you're feeling really overwhelmed or really confused about your emotions, you're going to benefit from this video. Let's start by looking at some signs that might indicate you could benefit from DBT. And while this is not a definitive diagnosis, here's a few key indicators. 1, you have intense emotions. Do you find yourself experiencing emotions that make you feel overwhelmed, out of control, or emotions that are just maybe even so physically or emotionally painful that you don't know what to do with them? If that's true, DBT can definitely help you learn to manage those intense feelings and emotions. 2, do you have difficulty in relationships? If you often struggle with interpersonal relationships, whether it's constant conflict, feeling disconnected, not trusting others, or fear of abandonment, DBT does offer tools to help you improve communication and connection. 3, do you have impulsive behaviors? Are you engaging in risky or impulsive behaviors like drinking too much, using illicit drugs, binge eating, verbal outburst, or self-harm? These can all be signs that you need additional support, and DBT can definitely help you with reducing impulsive behaviors. 4, chronic feelings of emptiness or dissociation. If you frequently feel empty or disconnected from reality, these feelings can include things like that are around you don't seem real, or maybe seem distorted in some way, or possibly you don't feel real, or you might feel like you're watching yourself through a glass or a movie or something like that. If that's the case, DBT can definitely help you reconnect and find some meaning. 5, struggles with self-identity. Many people in need of DBT have a fluctuating sense of self, or they don't know who they really are at all, so they lack an identity. This type of therapy can help you provide clarity and some stability and help you kind of, identify what is important to you, what kind of values you have and beliefs that you have, and how that can kind of cultivate a sense of identity for you. 6, self-harming behaviors or suicidal thoughts. Have you deliberately hurt yourself physically, such as punching yourself, banging your head on the floor or the wall, or banging it on another hard surface? Have you been burning yourself or cutting yourself? Have you made suicide attempts? Have you even threatened suicide or made a suicide attempt to get back at someone or to get even with them, or that you want to show them how much you're hurting? So if any of that information resonates with you, it might be worth considering DBT. So what can you expect if you decide to start? Learning DBT can sometimes be like learning a new language and culture, and you have to give yourself some patience and time to be able to pick up how to speak this language, or how to engage this skill and use it in your everyday environment. So don't expect after a couple of months of DBT that things are suddenly going to get better. Learning these skills and practicing these skills takes time and effort. It'll seem very scary at first, asking you to try on a new behavior, right? Asking you to change a way that you've always done something is very scary, because you don't know how that behavior is going to work for you. You don't know if this new behavior is going to be effective for you. So yes, it is very scary in the beginning. However, the more you practice the new behavior, the better you become at using the new behavior during a crisis. So the second thing I tell my clients is that just changing your behavior alone doesn't solve everything for you. Sure, we can change some behaviors and help you manage a crisis more effectively. However, you have to learn to sometimes change the way you think about the world. And sometimes this is much harder to do than to try a new behavior. Changing your thoughts might mean you have to look at your belief system, your expectations. You may have to try to learn how to look at reality in a very new way, which is very hard to do sometimes. And so changing your thoughts and behaviors together are going to make it much more effective for you to reach your life worth living goals. So DBT is structured around 4 main components: individual therapy. You're going to meet one-on-one every week with a DBT trained therapist who's going to help you explore those thoughts, those emotions, those behaviors, those impulsive urges, and help you work on how to apply your skills in your everyday life. You'll also participate in skills training groups, right? So these are going to be weekly skills training sessions. This is a very essential part of DBT because you're going to learn all of these core skills that are going to help you with mindfulness, emotion regulation, relationship effectiveness, and crisis survival skills. Phone coaching. So many DBT programs offer support outside of sessions. This way you can reach your therapist for guidance in real life situations and get real-time help implementing a skill in the moment of a crisis and helping you apply the things that you've learned in skills group. Consultation team for the therapist. So part of a comprehensive DBT program is consultation team, and the DBT therapist will meet for a consultation team to support each other and ensure they're providing you the best possible care and making sure that they are adhering to the DBT framework, making sure you're going to benefit from DBT. So now there is a form of DBT called DBT informed. And this is where you get some key skills, but you don't get the whole comprehensive program. However, both comprehensive and informed DBT can be very beneficial based on your specific needs. Now, the more you're struggling in those core areas with like emotion regulation, impulsivity, self-harming behaviors, the more of those kinds of things that you have going on and the more overwhelmed and dysregulated you often feel, the more likely you're going to be benefiting from a comprehensive program. However, if you've got a few things that's going on, then maybe DBT informed therapy can help you have a new way of looking at yourself and the world. Let's take a look at what it's like to start DBT. So starting DBT can feel very daunting and scary. And it's really difficult to look at yourself in a new way and to look at your mental health in a new way and learn how to do things differently. So you're going to learn new skills. You're going to gain practical skills and tools to help you manage emotions and improve relationships. Now, learning these new skills has to be applied outside of the therapy office or the skills class. It's not going to be beneficial to just come in and learn the skill and say, oh, yep, I think I've got this, and then go home and never use it in your environment. So you're going to have to figure out how to incorporate that new skill in order to benefit. So personal growth. DBT is designed to help you build a life worth living. It's going to focus on your goals, your values. You get to dictate the treatment plan. You get to help with the therapist on how to develop your treatment plan, what's going to be best for you. The therapist is going to know what kind of skills and things that you're going to need based on your values and your goals. And also, being part of the DBT program, you get a supportive community. So being in a group setting fosters a sense of belonging and understanding, right? It lets you know that you're not alone in your struggles. And sometimes other people struggling with the same things that we're struggling with may have a very different way of utilizing the skill that maybe you haven't thought of that might be very beneficial for you. So DBT takes time, change takes time, and that's okay. That's why this program is generally at least a year long. So you celebrate the small victories along the way as you continue to work toward those overarching life worth living goals. So what is comprehensive DBT? So that is a full program structure, right? It involves the once a week therapy, the once a week skills group. It involves the phone coaching and the consultation teams. How do you know if it's a comprehensive or a DBT informed? Ask your therapist. Your therapist will be able to tell you how they practice DBT and how they present that to their clients. So focus on BPD. So primarily, DBT is designated for individuals with borderline personality disorder or severe emotional dysregulation. Extensive training. So therapists undergo rigorous training and certification for DBT principles and practices. So feel free to ask your therapist, how many hours of DBT training have you had? What do you like best about DBT? How did you decide that you wanted to be a DBT therapist? Feel free to ask your therapist questions because Every therapist is going to be excited that you're interested in DBT, and they're going to be excited to answer those questions for you about DBT. So DBT is also research-based, right? It's an evidence-based practice. That means there is a lot of research out there that demonstrates that DBT is effective, particularly for borderline personality disorder, but also for various other mental health issues as well. So feel free to ask your therapist, even if you don't have BPD, feel free to ask your therapist if you would benefit from some of the skills and concepts in DBT. So what is specifically DBT informed? Well, DBT informed therapy is much more flexible for you, right? It incorporates the DBT principles and skills, but the therapy is going to not follow the full comprehensive structured program, right? It's going to be a much broader application. This is where maybe it's going to apply to other areas of mental health, not just BPD. So maybe this is where you have depression, anxiety, substance use, something like that. It's for the DBT informed. Also for DBT informed, it's less intensive in training. So therapists may have had training and concepts, but they might not be, certified in a comprehensive DBT program. Maybe they haven't taken training for a comprehensive DBT program. Maybe they have just learned how to present the skills modules and learn how it benefits individuals that don't have criteria for BPD. And lastly, DBT informed has a big emphasis on adaptability. It allows the therapist to adapt the DBT skills to fit your individual needs without the full structure of a DBT comprehensive program. Sometimes DBT informed can be used as a supplement to other therapeutic modalities, and that way it can help you kind of have an enriched, treatment. Maybe you don't need all of the skills, but maybe you would benefit from some of those skills. So in summary, comprehensive DBT is a structured intensive program primarily aimed at borderline personality disorder, while DBT informed therapy adopts principles for broader therapeutic contexts. So if you're considering DBT, reach out to a mental health professional to discuss your needs and your options. Thank you for watching. If you found this video helpful, please give it a thumbs up and subscribe for more insights into mental health and DBT therapy. And remember, seeking help is a sign of strength. We'll see you next time.